Amniotic fluids and amniocentesis. Amniotic and in late pregnancy by the fetal urine and lung secretion. Coming to the volume of the amniotic fluid is around 800 to 1200 ml in the early pregnancy, and near term the amount decreases. The composition being water, electrolytes, glucose, proteins, lipids, hormones, urea, and uric acid, and the extra composition when compared to the adult blood circulation is presence of fetal cells in the amniotic fluid. Now, what is this amniocentesis? Is amniotic fluid analysis is done using amniocentesis, wherein the amniotic fluid is aspirated under sterile condition around 15 week of gestation. Now, why is this done? To identify variety of disorders. So, karyotyping can be done wherein the chromosomal structure and amount is studied. So, this is mainly done to identify chromosomal anomalies, and the most common chromosomal anomaly is trisomy 21, wherein extra chromosome 21 is present. It is also known as Down syndrome. Apart from that, the other chromosomal anomalies that can be used to diagnose is Edwards syndrome, which is trisomy 18, and Patau syndrome, trisomy 13. So alpha fetoprotein can be estimated in amniotic fluid. Its concentration is increased in neural tube defects and decreased in Down syndrome. LS ratio, that is lecithin sphingomyelin ratio, when the ratio is more than 2, it indicates the lungs, fetal lungs are mature. If the ratio is less than 2, it indicates the neonate is prone for respiratory distress syndrome. Bilirubin, when the concentration of bilirubin is increased, it indicates the future prediction of hemolytic disease. And the amniotic fluid can be cultured and subjected to polymerase chain reaction to identify congenital infections. So apart from that, the amniotic fluid, if the volume is altered, if the volume is more than 2000 ml, it is known as polyhydramnios, and when the volume is less than 500 ml, it is known as oligohydramnios. Now the volume itself is an indicator of so many other disorders. When the polyhydramnios is seen, polyhydramnios is seen in condition when the mother is suffering from diabetes, also known as gestational diabetes mellitus, when the fetus is suffering from neural tube defects, and fetus is suffering from esophageal or duodenal atresia, and in multiple pregnancy. In all these conditions, the amniotic fluid concentration rises to more than 200 ml. So when the concentration of amniotic fluid is less than 500 ml, it is known as oligohydramnios, and this is seen in fetal renal agenesis. When kidneys fail to develop in the fetus, it results in oligohydramnios, and also in urinary tract obstruction. So post-term pregnancy, when the pregnancy crosses the estimated date of delivery, it is known as post-term pregnancy. So the amniotic fluid start decreasing, and in conditions of placental insufficiency, that is decreased flow of nutrition and decreased excretion of the waste products from the fetus because of placental insufficiency, seen in conditions like pregnancy induced hypertension and preeclampsia. So this was about amniotic fluid. Stay tuned for more such updates. Thank you. Happy learning.